Dementia. Dementia is broken down into three word parts. The prefix de hyphen means down, the word root means mind, and the hyphen ia means condition. Dementia, as defined by our book, is a group of symptoms marked by memory loss as well as the loss of other cognitive functions such as perception, thinking, reasoning, and remembering. The World Health Organization defines dementia as a syndrome, normally as a chronic or progressive nature, in which there is a deterioration in cognitive function beyond what is expected from normal aging. Dementia affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment, but it does not affect consciousness. Older people are the ones typically affected by dementia, but it is not a normal part of aging. Dementia occurs due to a number of diseases, such as Alzheimer's, vascular dementia, and dementia with Lewy bodies. Alzheimer's also contributes to 60 to 70% of dementia cases. 7 stages of dementia. The first 3 stages of dementia are known as pre-dementia. In stage 1, there is no cognitive decline, and it is known as the normal functioning stage. This means the patient does not show any significant problems with any cognitive impairment. In stage 2, age-associated memory impairment, the patient will have occasional lapses of memory as it pertains to object location and forgetting names. Often, this slight decline in memory tends to be normal aging, but could also be a sign of dementia depending on other symptoms the patient may have. In this stage, signs are undetectable through clinical testing. In stage 3, mild cognitive impairment, clear cognitive problems begin to arise. Some signs to look out for here are if the patient gets lost easily, forgets the names of family or close friends, misplaces or even loses important objects, and even difficulty concentrating. As these symptoms manifest and interfere with the patient's daily life, he or she may start experiencing mild or moderate anxiety. In stage 4, mild dementia, dementia patients can become socially withdrawn, showing changes in mood and personality. They also begin to deny their symptoms and get defensive. They have no trouble recognizing familiar places or faces. Some behaviors to be on guard for are disorientation, trouble remembering their own personal history, trouble remembering current events, and even having a hard time handling their own finances or travel plans. In stage 5, moderate dementia, patients will need some assistance to complete activities of daily living, also called ADLs. The main sign to watch out for here is the patient's ability to remember important details, such as the name of a close family member or his or her home address. Patients can get confused about the time and place, forget their own basic information, such as their telephone number or address. They can still remember their own name, spouse's name, and the name of their children. They can also do most basic ADLs, such as eat, use the restroom, and shower on their own. In stage 6, moderately severe dementia, patients tend to need full-time care every day. They forget the names of their children, spouse, or even their longtime caregivers. At this point, they cannot remember recent events, are unaware of their surroundings, and have distorted memories of the past. Patients in this stage tend to wander, have difficulty sleeping, and may experience hallucinations. In this last stage, severe dementia, the brain appears to lose its connection to the body. The person loses all of their motor skills and loses the ability to speak at a faster rate, frequently losing all verbal and speech abilities. Patients in this stage will need help with all of their ADLs. In most cases, dementia is irreversible as well as incurable, but with early diagnosis and proper care, its progression can be slowed down. There are preventative measures that may decrease the risk of dementia. These are staying physically and socially active, completing mentally stimulating activities such as crosswords and word searches, drinking in moderation, not smoking or doing drugs, eating healthy, as well as managing diseases such as diabetes, high cholesterol, and high blood pressure. Doing the above may also slow the progression of dementia. Therapies that can help with dementia are cognitive stimulation therapy, which has been clinically proven to help with mild and moderate dementia. This consists of memory training and language ability exercises that help increase memory and reasoning without medication. Behavioral therapy is used by family or loved ones and is twice as effective as antipsychotics for anxiety, wandering, or insomnia. Other therapies that are used are Montessori-based therapy, reality orientation therapy, and validation therapy. Aricept, Razidine, and Exelon are prescribed to decrease disorientation, confusion, and memory problems. Namenda is normally prescribed to improve memory, attention, and reason in a dementia patient. Medications for reversible dementia that is not caused by Alzheimer's are vitamin B12, hormonal supplements, antibiotics, and other medications.